The main thing here is that we got tightness in our hips. Okay, we have some edema in our legs. We got a lot of stiffness in our back. Just to keep it simple for now, we want to stretch out the posterior side of the body, right? The hamstrings, which pulls on the pelvis, and the tightness of the spine. The best way I like to do it is just a forward fold like this. You let gravity slowly pull and melt you down. On a bad day, I'll start at night like this. And over the course of an hour or so, we will slowly fold down, okay? As you're pulling, just like pulling on this cloth, that pressure is going to cut off your circulation. Your legs might go numb. Your back might go numb. It's not going to get comfortable. The discomfort is a sign of change. It's okay. But if that discomfort is making you tense, it's time to stop. The whole idea is to let go. So anything you do causing tension is counterproductive. Okay? You don't hold it long enough. You don't encourage it to fold long enough. It won't change. You don't give it enough time, it won't change. You force it, you will rip it. You need to encourage it. And I work with horses now. I kind of use them as an example. They're such big animals, I can't make them do what I want them unless they want to do it. So I show them the direction and I wait until they feel safe, and then they come. That might take hours, that might take days, whatever. But the point is, it takes time. And you just wait. You be patient. That's the most important thing. So you be patient, let yourself fold and melt. Okay? When you feel that tension, you want to slowly lie down. But if you hold it for a long period of time, it's going to get achy. You might not be able to straighten up. I'll just roll to the side, stay curled, and slowly straighten myself back up to Shavasana, your corpse pose. It's very important to use this pose if you hold a stretch for a long time, because you need it to recalibrate, to normalize. Once you feel comfortable, get up and do it again. Sore, lie down, rest. Once you feel comfortable, do it again. How often you do it depends how much time you have. The more time you have to rehearse, the better you're going to get at doing it. The next thing that I think is important is to lie down with your buttocks against the wall, hang your legs on the wall, and slowly just let the weight of that hand. Stretch out the inner thighs. If you pull your toes towards you, it'll stretch out your calves. But the weight will help loosen the inner thigh area, which often gets tight. Again, if it starts to burn and creates tension, it's time to slowly use your hands to help it back. Because if you hold it long enough, you might not be able to fold it. Use your arms, help it back, fold yourself down, straighten yourself slowly as you feel comfortable. Okay? And that's all stretching in one direction. If you put a big mound of pillow up under your shoulder blades, another mound under your pelvis, that's going to give you a space to arc. It'll stretch out the anterior chain. Same thing. Stretch it until you feel that tension and that release and it starts to get uncomfortable. Then slowly back it off. Get off the pillows and let yourself settle. And do it again. It's like folding a hard piece of plastic. The more you fold it, the softer it gets. Fold it too hard, you'll break it. Don't break it. Okay? Now the breathing part. Your pelvis and your ribs should be on the same plane. You want to use the abdominal muscles to maintain and control that plane, and the abdominal muscles should be flat around that. It's like a belt. Cinch up tight. You don't want your abdomen pulling too far in. You don't want it sticking out. You want it to be all in the same plane. Now contain this as you try to breathe into the side and the back of your rib cage. Imagine using your lungs to stretch out your ribs. So in terms of the rib cage, a lot of people are very tight to their back, and when they pull their shoulders back, they push the ribs forward. That's because the muscles on the front are too tight and they're pulling the ribs up. You need to soften the front, let the back round. The rib cage should be like an egg shape. It should be rounded forward and backwards to provide space for your lungs. If your back is banana shaped and your lungs are pushed forward, there's constriction in the back. It's not good. So you want to use the muscles to relax your front of your ribs. Use your breath to expand your back to loosen up all of that area. Okay? That's it for now.